So most of the time, they're going to recommend surgery because in all reality, what else does your conventional practitioner really have familiarity with? It's going to be anti-inflammatories, maybe some pain medication, and they're also going to tell you to do cage rest. Well, most of the pets coming in with a cruciate tear probably did so when they were being fairly active. We see a lot of younger dogs dealing with cruciate injuries, and it's probably because they're super duper active. Well, trying to take a 2-year-old to 6-year-old dog and putting them on kennel rest for several weeks is a little bit of a stretch. Most people have no idea how they're going to do that, and it really just isn't as feasible as one might think. Now, same can be said for doing our pain medication and our anti-inflammatories. Both are very effective at their job, and we definitely want to manage the pain and discomfort. However, when you get these pets feeling really good, even though they're still dealing with a torn ligament, they'll probably run like a crazy person and re-injure that knee. So it's one of those things where it's not a one and done, let's go get surgery done on this knee and all is forgotten, all is well. No, this is months and months of progress, of things that you really need to deal with. So you've not only got to deal with the MRI, the surgery, the cage rest, but then you have to go through rehab. So all of this can take 3 to 4 months before you even get close to a full recovery, while also dealing with the thought that, hey, the other ones had to compensate for this knee the whole time, which is the reason why so many of them tear the other one within a couple of months. So why on earth would somebody come see a chiropractor for this? Well, the basis of it is really structure. If you have poor structure in that knee, what's going to happen is you don't have a very stable environment for the knee to heal. Now, a lot of people are under the impersonation that knee joints cannot heal on their own, which just really doesn't make any sense, because in all reality, if an animal was in the wild and injured a knee joint, I'm pretty sure that ligament would have to heal on its own at some point. I think what they're trying to say is that the knee and these ligaments has very little blood flow to it, which is why the healing process is so slow. So what we really want to look at as an alternative practitioner is how feasible is it that we could possibly help kind of initiate and help this knee heal on its own without ever having to go the surgical route. So the first thing we really look at is really how much tearing are we thinking exists. So even though without an MRI you can't know for certain, a lot of times just by feel you can kind of get a feel for whether or not you're dealing with a completely torn ligament or just a partial. So